With nearly half of all COVID-19 deaths in Canada linked to long-term care homes, the federal government is urging these homes to follow the latest national guidelines laid out to stop the spread. These measures announced include restricting visits to essential staff only, screening people who enter, increasing routine cleaning, infection control training for staff, and limiting staff to working at just one care home, plus limiting their movement within the facility. But are these measures enough? Joining us now is Jane Meadus from the Advocacy Centre for the Elderly. Good to speak with you this morning. Your reactions to these new federal guidelines?
Well, certainly in Ontario, those are the kind of guidelines that we've already seen. So it isn't anything really new. I think it's definitely something that people need to be doing anyway. I'm hoping that that's something that's been happening across the country, but they're definitely part of what has to happen, but they're certainly not sufficient at this time.
What would be sufficient, in your opinion, Jane?
Well, I think we have to really deal with the issue of what are we doing where where the first person is diagnosed with COVID. Long-term care homes, especially the older ones, just aren't conducive to infection control, isolation. We're seeing people being told to isolate residents for 2 weeks when they're admitted to homes if it's a non-COVID home. These are just impossible things in long-term care. And so something else has to be done, whether it's taking people to hospital, which is not happening in Ontario, or taking some other kind of steps to ensure that people are not infecting the others in the home.
There are two sides to the issue of staffing that have come out since some of these stories started to come to light, and these numbers are staggering. One is the challenge of the workers who are there who say they feel under threat and are maybe not compensated well enough for the job that they're doing in order to take that risk, and also for the workers themselves who are having to self-isolate because they have been exposed to COVID-19. Just some of the challenges that are facing our seniors right now who are in these homes. There's not enough people to work in the homes to take care of them.
Yeah, and that's historically been a problem. That was something that we dealt with at the Deluce inquiry into the Wettlaufer murders. There was a committee in Ontario that was looking at staffing in long-term care. It's something advocates like myself and others have been complaining about for years, that especially the personal support workers were not well paid. They do the brunt of the work, and it's very hard, difficult work, and yet they make less than $20 an hour very often. And the nursing staff is not properly compensated either. And so they have a lot of trouble getting registered nurses working in the homes. So then you add this on top of that, plus a PSW shortage, and it's just a recipe for disaster.
And our seniors and most vulnerable are the ones who pay that price. We're speaking later with the Minister of Seniors, Deb Schultz. What would you like to ask her?
Well, I would like to ask her what she is doing to work with the provinces to deal with this issue of isolating seniors who've come down with COVID, and how are they going to deal with it so that this disease doesn't spread throughout the home when someone gets it.
Jane Meadus, I want to thank you for joining us in your morning.
Thank you.
Thanks for watching. If you like this, be sure to subscribe here.
And you can check out more Your Morning videos right here.